All right. Good morning, everybody. How are you all today? It's nice to see you all here. I'm Dr. Jeremy Ragsdell. I'm a psychiatric resident at Our Lady of the Lake. I'm here to talk with you guys today about some things that I think are pretty important, particularly regarding mental health, things like stress, anxiety, depression, and hopefully how to recognize some of those things in yourself when you're experiencing them, if you're experiencing them. So with that in mind, I just kind of like to start at the beginning, I guess, with talking a little bit about, what are anxiety disorders? What is depression? A lot of people talk about these things and they mean a lot of different things to a lot of different people, but the fact is they're a very specific thing to mental health professionals. They mean a very specific thing to people being treated for depression, people being treated for anxiety. And I think important also to know is when stress becomes more than just stress, when it's something that is lingering, when it's something that you can't seem to get beyond, where it weighs on you constantly all the time. And in my opinion, that's kind of when it's a good idea to go and reach out to somebody, and that can look like a lot of different things. But before I get into that, I just want to talk a little bit about, stress. For some people, this is what stress looks like. And for some people, they can deal with that. That's fine. They're sitting in a room and everything's burning around them, and they're fine with that. They can deal with that. But not everybody is that way. And we don't know why. We don't really know why some people are more resilient and they're able to get through that stress more than other people are. What we do know is that things like exercise, things like eating well, things like, being connected with your family, that helps with stress, but not always, not always. So to start out, I want to talk a little bit about generalized anxiety. And these are some facts that we know about it. So 1 in 5 adults in the United States each year will be diagnosed with an anxiety disorder or a mood disorder of some sort. And by mood disorder, I mean things like depression, things like anxiety. That's a mood disorder. And each year, 20% of adult women will be diagnosed with some sort of mood disorder, whether that's anxiety, whether that's depression, more serious things like bipolar disorder, PTSD. Those are included in there as well, but generalized anxiety is really the most common mental health disorder that we recognize in the mental health profession as affecting the most people. So what does that mean for a mental health professional? This is a busy slide, and you can read it, but I'll also talk a little bit about it. So for a psychiatrist or a psychologist or anyone you see that's a mental health professional, these are the sorts of things that they'll be asking you about. And it's important to remember that everyone is different. Everyone experiences these things differently in their own unique way. But what we do know is that it's a change in your normal baseline functioning. And that's how we recognize when something is not quite right. When you're doing well, and then you start to notice, I haven't been quite myself for some time now. I'm not really sure what's going on. If you start noticing some of these things, like excessive anxiety, excessive worry, and I'm talking about worry about different things. It's not just, you're not just worrying about your health. You're worrying about bills. You're worried about the weather. You're worried about getting to work. You're worried about your car getting a flat tire. And it just seems like you're just spinning around, just constantly worried about something. That's the kind of worry I'm talking about. And it's difficult to control that worry. You can't stop it. You're just thinking to yourself like, I know that I shouldn't be worried about this. Why do I care if it's going to rain today? I don't know. But you're still thinking about it. It's just constantly on your mind. And because of that worry, we experience these typical symptoms, like that restlessness when you feel like there's just something in your chest. You just got to squirm around a little bit. You just got to move. You're easily fatigued because you may not be doing anything. You may just be sitting around all day, but your mind's busy. You're very busy in your mind, just constantly worried about things, and that can be tiring. That can be tiring. And because of that, you can't concentrate on what you want to concentrate on. It's like you're a slave to your mind almost, like your mind is just taking over, worried about things you don't really care about. You're more irritable with people, you have trouble with patients, you push people away. Muscle tension, sleep disturbances, those are all common. And by sleep disturbances, I mean maybe you can't get to sleep, maybe you're sleeping too much, maybe you wake up in the middle of the night and your brain just goes, time to start worrying. You're 0 to 60 just like that. It's 2 in the morning and you're worried about the weather. You don't know why, but you are. So what does that look like for you guys? You know, that's what it looks like for me, but maybe that's what it looks like for you. I don't know. But typically, it's the things that I talked about. You're worried about those small things, and those small things just, they add up. And to give an example, one thing I hear often is, I see a lot of college students, so they may be late for a class, and from there they think, oh, I'm 5 minutes late for this class, now the professor hates me, and I'm gonna fail the class, and I'm not gonna graduate college, and I'm gonna be homeless, and then you see how from there it just builds and it builds, and that's what an anxious person thinks like. What about depression? So major depressive disorder affects 17.3 million adults in the United States. That's huge. That's like almost 5, 6, 7% of people in the United States. And we know that women are twice as likely as men to suffer from depression. In each year, 1 in 9 women aged 18 or older will have had a major depressive episode. That doesn't mean that you were diagnosed with a major depression. That doesn't mean that you saw somebody for it. It means that we know 1 in 9 people will have met the criteria for a major depressive disorder. And of those people, it's typically women, unfortunately. So this is what it looks like for, again, a mental health professional. This is a busy slide again, but what's important to know, again, is a change in your baseline functioning. And what I mean by that is, again, you're going along, things are great, and then suddenly they aren't. You don't know why. Something may have happened, something may not have happened, but something's different now. And so to be diagnosed with a major depressive disorder, that change in functioning has to be present for at least 2 weeks, where more days than not, you're experiencing some degree of these symptoms. And one of those symptoms has to be that you're sad. You're either sad or you don't enjoy things. Anhedonia is just a fancy way of saying that usually pleasurable things no longer interest you. Maybe you like to watch TV, and then you're sitting down and TV is just like, bleh. You just hate it. That's kind of what it is, just apathy. So in addition to those two things, you also have those feelings of worthlessness, that guilt, that just, it weighs on you almost. It's kind of like you're just blaming yourself constantly, like, why can't I snap out of this? Well, I shouldn't be sad. I have no reason to be sad. But you just can't snap out of it, and it's isolating. It just brings a lot of shame, and that's what I mean by excessive feelings of worthlessness, guilt, shame. And then just like with anxiety disorders, it's easy to become fatigued, you lose concentration, your appetite changes, you're gaining weight, you're losing weight, you feel worse about yourself because you're gaining weight, you don't understand why you're losing weight. It's just a constant cycle that people get stuck in. And it can be lonely. It can be very lonely. And I mean, psychomotor agitation is just another fancy way of saying that people notice you're either moving more slowly or you're moving more quickly than you usually are. So it has to be observable by others. So imagine yourself moving through quicksand, and people are seeing that. It's like you're carrying a lead weight, and your body reflects that. So some of these things, just to keep in mind, if you're experiencing some of these things, you might be suffering from a major depression. And it's more common than people think. Like 1 in 9 of you guys could right now have major depression. I thought this was a good picture. Can anybody relate to that? Like just you're dragging your head along, just full of nonsense? I don't know. So that's what it can look like for a normal person, I guess. What we also know, though, is that it's not just psychological. It's more than that. And it affects you physically. Depression, anxiety, these things, it's more than just in your mind. It's in your body, too. And what I kind of alluded to some of that earlier with, you feel like you're walking through quicksand. You feel like you're carrying a lead weight. It just feels like there's something inside your chest that just just wanting to get out and just like a restless energy kind of thing. So what are some of the common like physical symptoms that we know happen with anxiety and depression? Headache, especially right here, these areas, a lot back here too. If anybody's ever experienced that, it's probably because you're carrying that tension, that stress right there. I see you over there kind of. So that's one. You got back pain. And it's typically like in these big areas, the big muscle groups, because you carry, again, see if we can go back, because you're carrying that weight. So you get it in your lower back, you get it in your upper back, and those muscles, they just get tired, and you feel fatigued, and you feel pain. We know that depression makes any chronic pain worse. So if you already have some sort of chronic pain disorder, a lot of people do, especially women. Women have chronic pain disorders very, very often. Fibromyalgia, I'm not even going to try to list them, but that's one of the big ones. And it can make any pain worse. Any pain you currently feel is going to get worse with depression. And if that's not enough, it can feel like you're having a heart attack. It's like, it's a big joke, you know. Not only are you sad, but now suddenly you think that you're having a heart attack. Like, that's not great. And that's honestly one of the biggest reasons people will present to the emergency room to be seen for the first time ever with an anxiety disorder, is because they think it's the big one. But really they're just anxious. And that seems kind of, I guess that can be diminishing in a way to say, that it's just anxiety, but I think that it's apparent here that these things affect us globally. They affect every aspect of our existence. It makes it harder to get along with people. It makes it harder to do your job. It makes it harder to get along with your family and have fun in the world. I mean, it really just takes everything away from you, is what anxiety and depression can do to a person. So what can we do? There's a lot of information out there. Unfortunately, in the information age, good information is even harder to come by than usual. So I think a good place to start is just reaching out to someone. Tell a friend, tell your pastor, tell your primary care doctor. All of these people are a good way to start. And it's important also to remember that with mental health, the journey is not always a straight path. It's not always easy. It's more like navigating Baton Rouge during rush hour. It's not always fun, and it usually takes longer than you think it's going to. If you look in there, I'm sure you can see some people. But anyway, so I digress. But it's important to remember that you have a lot of options. There's a lot of help out there for you. And somewhere to start, maybe talking with your primary care doctor saying, hey, I think I went to this talk and this dude was standing up there. He was telling me, yeah, I might be depressed because I've been sleeping a lot more lately. I find it hard to peel myself out of bed in the morning. It's like, usually I could get up and just like a shot and I was out the door. But lately it's just like, I just can't start moving in the morning. I don't know what it is. And you may not be sad, but you used to like doing a crossword, or you used to like reading a book, and suddenly that doesn't interest you anymore. You just don't care about things like that anymore. And at that point, if that's happening to you, maybe go talk with your primary doctor about that. If you have one, you should have one. If you don't, that's a good way to start. They can give you good resources in the community with reaching out to a psychologist, a psychiatrist, a therapist, a licensed social worker. Those people are all mental health professionals that provide a variety of different services. It might be useful to kind of go over a little bit about what each of those people can do, since typically if you haven't experienced this before, you don't often know what is out there for you. So I'll start with a person like me, a psychiatrist. What a psychiatrist does is talks with people, kind of assimilates that data that you have to give me. Say, You don't know that you're depressed, but you're experiencing these things, and it's different. It's not how you're used to functioning. I take what you tell me, and I put that into a nice little box. It doesn't mean that that's who you are. It doesn't mean anything about you, but it just helps to understand that the symptoms you're experiencing are related in some way to these anxiety disorders, these depressive episodes, things like that. And generally, a psychiatrist prescribes medication. They can do therapy, depending on the psychiatrist, like individual talking therapy. That's an option. And then below, I'd say below that, but next in line would be a psychologist. Psychologists can also prescribe medication for certain things, which is confusing to some people because not in every state can a psychologist do that. But in Louisiana here, we have the ability for psychologists to prescribe medications. And psychologists are more, they get more deep down into it. There are more forms to fill out, things about your personality, things about your functioning in your daily life. They typically do things like therapy, talk therapy, behavioral activation, which is a fancy way of saying they're going to tell you to get out of bed in the morning even if you don't want to. I mean, that's the truth of the matter, you know? There's something about that inertia that we get going and then we keep going. So they can help you kind of build a plan to do that. And a social worker, those guys are more, they focus more on the therapy aspect of it, the one-on-one individual counseling, the family counseling. How do you talk with somebody effectively, and how do you communicate what you need, what you want, with someone else effectively in a way that gets you what you need and what you want? That's kind of what a social worker or a therapist in general can help with, those sorts of things. But what can we do now? What's something that is proven to work that you can do at home, you can do it in your car, you can do it in here. In fact, we're going to do it in here. Sorry. And it's just a little something else that can help you get through these periods of time when you're feeling not so great. You don't always need medication, but sometimes you do. Sometimes you do. So what I'm talking about is meditation. Has anybody heard of meditation? So I'm sure you've heard of it. Unfortunately, what people don't often talk about is, what is meditation? You know, people say like, oh yeah, just go meditate, it'll be fine. But they don't often talk about how to do that or what that looks like. So I hope that I can kind of explain it to you guys here today. So meditation comes in many forms. A lot of you probably already do it. Exercise can be meditation. Sitting and drinking a cup of coffee, that can be meditation. Just sitting quietly and observing your surroundings, that can be meditation. It comes in many different forms, and it's not a specific act, it's not a specific event. You may not even know that you're meditating when you are. What it is a state of mind that you're trying to achieve. And I think that's where people get lost, is that it's counterintuitive in a way because the direction is to think about not thinking. Yeah, right? Exactly. Empty your mind. Like, that's what they say. That's hard. I mean, let's be honest. Who in here can really empty their mind? I can't. I can't at all. But that's why it's difficult. That's why meditation is hard. That's why it's more than just sitting down and not thinking about things, because you're practicing emptying your mind. And you're going to have thoughts. They're going to occur. But meditation teaches us to let those thoughts just pass by. Just because you're having a thought doesn't mean that thought's important. And I think some people forget that sometimes. You don't have to give a thought any recognition if you don't want to. It can just pass right by you. And meditation helps us do that. So by actively practicing meditation, it kind of builds into our day-to-day life where those thoughts that we're having, they pass more easily. So maybe today you're worried about the bills that are due 2 months from now, but maybe you meditate and you think about it and you realize, you know, I don't really have to think about those bills that are due 2 months from now. So for the next 5 minutes, 5-6 minutes, I want to challenge the skeptics in the room to suspend their disbelief and follow along with me for a brief guided meditation. And maybe you can see some of the effects. Hopefully it can help you a little bit. And if not, that's fine too, but I think you owe it to yourself to try. And you don't have to follow along if you're uncomfortable. It's not required. Just sit quietly and watch everybody else, if that's cool. So if you're anything like me, when you think about meditation, you probably think of a monastery in the mountains. It's quiet. They're monks. Maybe they're going, maybe they're not. But what we're going to do here today is to just sit quietly. I want you to take a moment and just really relax in your chair. Just sit there. Just connect to your chair. Get used to it. And get your feet on the ground. Really feel your feet connecting to the ground. And I mean that seriously. Like, just think about how the connection between your feet and the ground and your body, and just breathe deeply and slowly. And when you feel comfortable, I want you to close your eyes. Take a deep breath in and slowly breathe out. I want you to start by focusing on your toes. Really think about your toes. Just scrunch them up and just let it go. And feel any tension you might have there just leaving your body. And I'll slowly start to move up your legs. Relax your ankles. Just move them around a little bit. Feel the tension you might be holding there. Move up to your calf muscles. Relax those. And all the while, breathing deeply. And then relax your thighs. And feel that tension going through your body. Take a few deep breaths again. And remember to let any thoughts you have go up and pass through your consciousness like a cloud moving over the sun. We're breathing deeply. We're going to focus on our lower back. Any tension you have in your lower back, feel it, find it, breathe in, and let that tension out. And your upper back, your shoulders. I want you to lift your shoulders up to your ears, as high as they can go. Breathe in deeply, and then relax your shoulders. And feel that tension going from your shoulders to your lower back, to your legs, down to your ankles, out through your toes. And all the time we're breathing in deeply, letting our thoughts pass. We're not paying them any mind. We're not worried about those thoughts. They don't matter right now. Next, I want you to think about your neck. This is a place where tension likes to hide. Just move your neck around a little bit. Just relax. Feel your neck relaxing. And think about your jaw. A lot of people carry a lot of tension in their jaw. Just try to relax your jaw if you can. Take a deep breath in and feel that tension leaving your body. And now let's go to the top of your head. Just lift your shoulders up one last time. Breathe in deeply. And as you exhale, feel any remaining tension sink down through your body, out through your legs, down into the floor. Take another deep breath. That's perfect. And I want you to sit and enjoy this feeling of relaxation and calm. And just breathe deeply. Keep your eyes closed if you can. And now, still with your eyes closed, slowly bring your attention back to the room. Listen to the sounds around you. Notice the presence of others near you. Feel your breath coming in deeply and out through your body, still releasing that tension. And when you feel ready, start to open your eyes. How's everybody feeling? Better? I hope so. Good. So, I hope I've shown you that you can relax. You can reach a feeling of calm. There's more to this, the whole mind-body thing than just taking medications or things like that. A lot of people fear the medications. I'll be honest with you. That's one of the biggest things that I encounter is a lot of people have a fear of medications. And before you get to the medication point, sometimes it's required, unfortunately, but there are things you can try to do. And I think meditation is a useful thing that we can do at home, in our car, when you're sitting in Baton Rouge rush hour traffic and you just want to honk your horn and yell at that dude in front of you. Center yourself for a moment and feel that tension in your body. Recognize the areas of your body where you're holding that tension. And just get more in tune with your body. Meditation helps us learn the parts of our body that we're not always thinking about. How often are we going throughout the day thinking, wow, my jaw muscles are really tight, or oh wow, my neck muscles are really tight? How often are we more frequently saying, man, my head hurts, and I have no idea why? Probably that one, I would estimate. So, I want to reiterate again that meditation is not always the answer. Sometimes it does require that you reach out to a professional. Somebody like me, somebody like a psychologist or a therapist, or somebody like that. Your primary care doctor is a great place to start. Again, I want to say it's so important to have somebody who's a physician or a nurse practitioner or somebody like that is following you throughout your life, and they know about you. They know when you don't know that you're not doing your best. That's the importance of having somebody there for you, is because we don't always know when we're not doing well. It's hard when you're in the midst of that depression to recognize that that's what's going on, because it is a mind and body disorder. And with that in mind, I think it makes a lot of sense that it's hard for us to know what we don't know sometimes. So with that being said, here's some resources that you can use to maybe reach out and find what's available for you. The first two up there are more information-driven sources. The NIMH is huge about mental health. Obviously, it's the National Institute of Mental Health. But it's a good way to go and find some data on the epidemiology of these disorders, how frequently they're occurring, who they happen to, why they happen, what they look like. The Anxiety and Depression Association of America is also a good resource to find more information about what I talked about a little today. The Psychology Today website is actually focused, I think it's a new thing that they got going on, but you can go and you can search your area of Louisiana and they will have a compendium of therapists, social workers, counselors, things like that are just available. They're just there, and you just call them. It's crazy. But really the best way to find somebody to go see is to call, if you have Medicaid, Medicare, things like that. Call your insurance company, ask them if there are any providers in the area that accept your insurance, or if there are any providers in the area that operate on a reduced fee, things like that. And then I felt it was appropriate to include these things also, since so frequently part of depression, part of anxiety are those scary thoughts. In fact, it's one of the symptoms of it is recurrent thoughts of death or dying or suicidal thoughts. It's so common with depression that it's one of the core symptoms of depression. So if you or anyone you know is having thoughts like that, know that you're not alone, that help is available, and that you don't have to feel that way. You don't have to. If anybody would like to take a picture of that, or I'll leave it up there for a little while longer. But at this point, I'd like to open the floor up to questions if anybody has any that they would like to ask.